Hi, I want to talk about how to prepare for your surgery, pre-op prep. Very important. And when you're going for surgery, especially cosmetic surgery, you have time. It's elective surgery, it's not an emergency, so make your lists and start planning. It is very important to really have a pad or your phone or something that you can start writing on, make notes and have a plan. And include in that plan your supplies, your ride and travel plans, your recovery plans, and everything, including questions and answers. And once you do that, I think you'll be very well prepared. And a few things that patients forget, and I'm going to go over those important things for before surgery. The number one concern that as a surgeon I have is my patient going to bleed more than average? So please help me by making sure you do not take anything by mistake that is going to make you bleed. Surgery is invasive. We make incisions, you can bleed, and we don't want you to bleed too much. Fish oil can stay in your system for up to 2 weeks. So please remember that. Stay away from fish oil for 2 weeks. Aspirin can stay in your system for up to 2 weeks. Please stay away from aspirin. Other medications like Motrin and Advil and ibuprofen and Aleve, 3 to 4 days in your system sometime. So stay away from those as well. A lot of the prescription pain pills like Mobic, Ultra, many of those, they have also NSAIDs. NSAIDs are the non-steroidal anti-inflammatory drugs like Motrin, which can be in there you won't even know. So always check and see which pills you should stop. For example, Celebrex you can't have. So check with us and stop those. You should continue with the essential medications for your blood pressure, diabetes and other things, but the blood thinners, they have to be stopped, so be very careful. A lot of supplements, everybody takes a lot of supplements, which is great, but supplements should not be mixed with anesthesia and the surgical medications in many cases, so be very careful and stop those in advance unless you really, really want to take it, then discuss with your surgeon in advance. So that's very important. Then remember that on the day of surgery, don't bring any valuables with you. Do not wear fancy clothes, please. Wear things that you can put on as like a jacket with the front top open, not like scrub or a pullover that you have to put on, because remember, you might have a big dressing on the head and you can't get it up or down. So save yourself some discomfort and have stuff that you can easily put on. Wear clothes that if they get soiled, you don't care about them, you'll throw them out. And try avoiding any jewelry of any kind, because some of the instrumentation such as bowies have radio frequency and that can interact with as simple as like an earring, and that can cause heat generation and it can cause burns in that area. Belly ring or any rings anywhere else, please try to get rid of those. No makeup please, because we will have to wipe it off anyway. And then also make your travel plans. Make sure you have a ride, make sure that you know how to get to the place and get there at time so you're not running late. You do not want to rush on the road. Also, a few days before surgery, start hydrating yourself. Many patients don't hydrate and they come in dehydrated. That leads to more nausea and more pain. So drink a lot of water as you're getting close to your surgery. Eat wealthy, eat really well, and also exercise regularly coming up to your surgery, because that's going to keep you in good shape and help your recovery process. If you forget anything else, please call us and we will guide you. Happy surgery.